Hello, one and all. Good morning, and welcome to another episode of Two Teacher Tuesday with your host, Dr. Stephen Zahm. Um, Today, we are going to talk about what I'll call the age-old question, um, and it's frankly it's the question that I think every dentist dreads being asked. Um, Keep in mind, I believe, as do most people, that there's no such thing as a stupid question. So I don't think this is a stupid question, but it is a question that we don't like to hear. And the question is this: I as the doctor of, you've come to me with a problem, a toothache of some kind or some other issue, and I've explained to you your options and what we can do to fix that. And typically, the first question that we hear is, well, is insurance going to cover that? I think most of my fellow dentists would agree that our heart kind of sinks when we hear that because, it's a fair question, um, especially if we're talking something more elective or cosmetic that isn't essential. But when you're having a toothache or, some other problem, even just a broken tooth, even if it doesn't hurt, that's something that you need to get fixed. And, obviously finances are always going to be a concern, but, letting insurance dictate whether or not you get that fixed is just, it crushes all of us as dentists because, the reality of it is we're your dentists. We know you on a personal level. We know your name. We know your family. We know your likes, dislikes. We know you as a person. To your insurance company, you're just literally a number. Um, so to let them dictate, what treatment you deserve, what care you deserve, is just absurd. The insurance company doesn't have the dental license or the knowledge to recommend any treatment to you, and really their goal as a business is just to make as much money as they can, which is basically to incentivize you to choose the cheapest option. For me, one of the most heartbreaking things is someone having a toothache and being given the options of either pulling the tooth or saving it with a root canal, both of which are topics we can talk about in a future episode. But um, too many times we see patients that choose to remove, it may be an infected tooth, but a very savable tooth with a root canal. Not all teeth can be saved with root canals, but when they can, they really should be. But I've seen too many patients choose to just have it pulled because most insurances will cover an extraction, but they don't want to cover a root canal because it's more expensive. And again, times are tight for all of us, and so finances have to always come into play. But we shouldn't be letting these insurance companies that have no knowledge of what is best for you determine what's best for you. That's where we as your dentists can give you a little feedback and our insight as the professionals, and then you ultimately have to decide what's best for you. But it's like I always tell my patients, when I get asked this question, I say typically your insurance, depending on the situation, will or won't cover this. But at the end of the day, finances aside, if money wasn't an issue, what would you rather do? And choose based off that, because let's face it, who here hasn't ever had an insurance claim denied? I think we all can say that we've had insurance fight us on something in the past, even things that they should cover, because as anybody that's worked for an insurance company will tell you, they typically are incentivized. They receive bonuses based on the volume of claims they deny. And that's not to say that anybody that works for an insurance company is a bad person. They're just doing their job. But typically they're looking for any loophole they can to deny it, even if it's something ridiculous that, you know, like saying you should have taken this specific type of x-ray for this particular situation when, as the dentist, it wasn't a necessary x-ray, but they use that as a criteria to deny coverage for something. So all that to say, you know, we as your dentists have your best interest in mind. Your insurance companies have their finances best interest in mind. So when push comes to shove, you know, you've got to do what's best both for your budget and for your mouth. But, you know, in my mind, your mouth should come first. And if budget's an issue, I know at my office we're willing to work with you. I know a lot of other great dentists out there are willing to do the same. So just keep that in mind, that, you know, choose your dentistry with what you would do in an ideal world where cost wasn't an issue. And then if your chosen option does create a financial issue, you know, work with your dentist. We want what's best for you, even if that means, you know, having to figure out some sort of alternative payment arrangement. So again, we're wrapping up the insurance mini-series. Got a couple more episodes after this, but otherwise, thank you for listening today. I welcome any questions, comments, concerns, feedback, but otherwise, we'll see you next week on Tooth Teacher Tuesday. Have a great week.